Hello and welcome to another Conversations with Dr. Westman. Today we're going to be chatting about the many benefits of keto. We also have a bonus for you. It's Dr. Westman's free top 10 fat loss tips. We'll put a link for you in the description. How are you, Eric?
I'm well. How are you, Glenn?
Very, very good. Thank you. So we've often heard you talk about the many benefits of a keto diet and some of the more popular medical conditions that a keto diet can help with, like type 2 diabetes, hypertension, GERD, metabolic syndrome. We'd love to hear about some of the other medical conditions that a keto diet might be helpful for.
Yeah, so those are the most common things people know a low carb, high fat, or keto diet helps. Most people know about it as a weight loss tool, and it goes way back. The Banting diet in England, the Atkins and Protein Power, South Beach. So most people know about it as a weight loss, fat burning diet, but it does much more. And what's exciting is that the research now is really getting started. For a long time, 20 years since I've been involved in this space, we really weren't able to do much research. There wasn't much research money available, and now that's changed. So that there's an annual meeting called the Metabolic Health Summit that has all of these people coming together to look at the new research, and it's exciting to see. In a clinic, I see people getting better and have a lot of signals about what things are getting better, but most doctors and scientists won't admit it or sign on until they know the mechanism of why it gets better. And that's frustrating, because doctors who use a keto diet see all these things get better, and then the researchers say, no, it can't happen because you don't know why it happens. And it's like, well, the sun comes up every morning, even though you don't exactly know why it happens. So there are so many things we see beyond weight loss, although, most people think of it as a weight loss diet.
So give us some of the other medical conditions that a keto diet would be great for, that you see in your clinic on a daily basis.
Yeah, so the serious ones, like medically significant, so that other doctors send me their patients, include fatty liver, or it's called non-alcoholic fatty liver disorder, NAFLD, or NASH, non-alcoholic steatohepatitis. It's all the same thing. It turns out that it's the carbs in the food that cause the fat in the liver. And I've seen doctors actually get that wrong, where the doctor will say, oh, you have fat in the liver, you have to stop eating fat in the food. No. That's not how it works. It's the sugar and starch in the food that causes the fatty liver. And the reason this has become a medically serious issue is fatty liver can cause cirrhosis of the liver, or liver failure. And some people need liver transplants if they can get access to it. You can transplant livers now, but I mean, it's a big deal. So the fatty liver, you might, if you hear that you have that, it might even be a very small change in the liver function tests on a blood test. You want to take that seriously and start learning about how carbs affect you and affect the liver, because that's, as a medically serious one that other doctors send me, fatty liver is a big one, and that's 100%. It gets better. Our study, was published 10 years ago on this, and it doesn't get much airtime in the current culture.
What else? How about another one, PCOS?
Right. Well, so another relatively common issue with women not being able to have babies, infertility. I'll be sent patients from other doctors when the OBGYN fertility experts exhaust all of their medical treatments. Yeah, a big theme here is most doctors are trained to use medicines or procedures, not lifestyle, not keto diets. So let's say a woman can't get pregnant. She has extra hair growth on the body, has irregular menstrual cycles. You may actually have ultrasound of the ovary to diagnose this polycystic ovary disease, although you don't have to have an ultrasound, can cause infertility. And then the infertility doctors try the hormone changes, manipulations, and even shots, and even in vitro fertilization is tried. And what happens to some people is they end up doing that and it doesn't work. And then the doctor goes, oh, well, why don't you go over to Dr. Westman and work on the weight? You know, it's kind of like an afterthought, which if only they tried this first and to see if it would work, because it's very cheap to do a keto diet. You're not using procedures and all that. So PCOS, or polycystic ovarian syndrome, a cause of infertility, can actually allow you to get pregnant in the first month or two. And you know, it's almost miraculous, because you may even get pregnant before the first period, which takes people by surprise. So we make sure women know that they can become pregnant very quickly if they change to a keto diet. And if you don't want to be pregnant, just know you have to take measures to not get pregnant. But that's another, you know, it's very gratifying. I'm not an OB/GYN specialist, but I've helped women get pregnant just by changing the diet. That's a nice saying that I'll sometimes shock the audience with. And, you know, this week I helped someone get pregnant. Oh my goodness. No, it's not what you think. It's because I helped the hormone changes by changing the diet so that someone wasn't eating the carbs. Now, the mechanism for this, it's not rocket science, which is another issue from the mechanistic world. A lot of these things are very simple. And so that even the researchers say it can't be that simple. And so they discount the mechanism is when you eat carbohydrates, the ovaries in women start secreting testosterone, which is the male hormone. And so males and females, we both have testosterone and estrogen, but it's the balance of that makes us male or female. So the carbohydrates make the ovaries make testosterone, so that the PCOS is really an abundance of testosterone, the male hormone. So you cut the carbs out, the testosterone is made less in the ovaries, the hormones change, you start getting periods, you start ovulating to have eggs to be able to get pregnant. So it's a medically important thing that other specialists try to help, and then I end up helping many of the people because the other specialists didn't think about changing the food, changing the lifestyle. So that's a NAFLD. I forgot even to say that I've helped people who had fatty liver come back in their transplanted liver. So they already had fatty liver to cirrhosis, and they got a liver transplant, and the fatty liver was coming back. So the doctors finally said, oh, why don't you go over to see Dr. Westman, see if he can help you fix the fatty liver. But it was in the transplanted liver. Oh goodness. So if you could only get into the time ahead of these things. So if you have fatty liver or tendency toward there, or infertility, you can't get pregnant, you have some extra hair growth, ask your doctor if you have PCOS. These are two very important, medically important conditions that get better with a keto diet.
How about possibly lesser known, what about joint pain?
Yeah, so very common for joint pains to get better. Even if it's, you know, what a orthopedic surgeon or a doctor might do an X-ray and they say it's bone on bone, you know, meaning the cartilage is gone. I have had people get better, the arthritis get better, and you know, I try not to oversell this approach, you know, and this is kind of my style, is that I'll help someone and then see if these other things are getting better, rather than being the, you know, and this is getting better and this is getting better. So my soft sell or I don't overemphasize how much it can do, but people come back with their joint pains gone, and it's just an extra bonus. And then of course they'll say, well, it's because I lost weight. And I said, well, it happened how soon? Well, in the first week or two. How much weight had you lost? Well, not much. No, it's not the weight loss, it's the diet change that helps the arthritis. And we know now the mechanism, although it's not worked out to the degree that some very skeptical scientists would want, but the eating carbohydrates, sugar especially, causes inflammation in the body. and the inflammation is often what's causing the joint pains. So you can reduce inflammation and reduce joint pains rather quickly by cutting the carbs out of the diet or doing a keto diet. In fact, I was visited by an orthopedic surgeon, so a doctor who does hip replacements, knee replacements, who lives in Sydney, Australia, actually. Dr. Doran Schur and his medical support person, Dr. Paul Mason, do a keto kind of program. And Dr. Schur explained to me that many of the people who came to him for a joint replacement no longer need the joint replacement because the pain is gone. And he estimated that about a third of the people didn't need the joint replacements anymore. And he was happy about that because there was plenty of business. And he is just that kind of doctor who is helpful and glad that he didn't have to do an operation on people. So that now, no research studies that I'm aware of to document to the degree of the most skeptical researcher what they would want, but this is a recurring thing we see in the clinic is arthritis pain gets better.
Skin tags and acne and other skin conditions.
Yeah, you know, if you look, yes, skin conditions generally get better, even to the point of even if you don't have a medical condition, the people tell me that the skin feels better, there's a better glow to it. You know, when you think about it, the dermatologists who've written books about what to do with the diet and the skin, they all say a no sugar diet. If you look at the popular diet books that are written by dermatologists. And so they've known for a long time that getting the sugar out is important. And then of course, what are you putting on the skin to make it softer and smooth? In many cases, it's fat, oils, you know, to keep the skin soft. So the skin does a lot better on a no sugar, high fat diet. And think of it that you're eating the fat that then gets distributed to the skin all over without you having to rub it on the skin. But even the medically important or ones that a doctor would use medicines for will get better or in some cases go away. The big one really, I think, is psoriasis. And it's a, you know, uncommon, but it's, there's enough of it around that there are medicines being sold now to treat psoriasis. And guess what the medicines do? They block inflammation. So you can, from my perspective, you can take a medicine to block inflammation, or you can change the diet to block inflammation. You know, it's really your choice, although many doctors don't understand the diet inflammation connection. But I've seen psoriasis get better, and then kind of if someone slips, they have some carbs, it will get worse fairly quickly. And then eczema, acne, all of these things are improved. I'm kind of waiting for the right person, and I'll help them to write the No More Acne diet book. You know, I would think that would be a big seller. For teenagers, I mean, sometimes you can't persuade people to change, but many teenagers are sensitive to the fact that they might have acne, and the low-carb keto diet really helps that a lot. To just repeat how that could be, I was giving a talk at Duke some years ago. I'm still at Duke, and one of the dermatology professors came up and told me after the talk that he traveled to an area in South America where there was no sugar, that the culture was so remote that there was no sugar. He's a dermatology professor, goes there and does benevolent work, and with, I think like with a church mission sort of thing. But he, as a professor of dermatology, he was very curious because this culture, these people had no acne during their adolescence. So the fact that you get pimples and acne is not normal unless you're having sugar, or it's not common. And so this is a very important thing, especially as we're trying to target younger people to not have so much sugar, the acne. And then I know it's not skin, but another common thing that gets better is the premenstrual symptoms of uterine cramps. So the menstrual cramps can often improve and in some cases go away, just as another reason to introduce this to kids who are have teenage years, especially if someone has a lot of acne, they don't know what to do, the doctors have tried medicines and all that. Just try without sugar and without refined sugar and starch, and you may see some really, really significant change that helps the appearance and then the mood and the self-esteem, that whole thing that, as you know, a parent of teenagers or was, that can be such a big deal at that age.
And last but not least, what about mental clarity? Because I know that people that embark on a keto diet, one of the biggest things that they comment on is the fact that they have so much better, clarity. They've gotten rid of their brain fog. Why is this?
Well, we're kind of going organ by organ in the human body, aren't we? And now we talk about the brain, and that's probably why most people stick to a diet like this, is that they don't have the brain fog. They're not falling asleep after meals anymore. They feel more energy. And again, we think that that's well, there are two things. One is the brain does very well on ketones. You don't have to have sugar in the diet, and your body will make all the sugar that it needs. It makes all the glucose in a process called gluconeogenesis. So the ketones fueling the brain actually has some people tell me they can feel it. The brain functions better. Kind of a dramatic example of this is a patient of mine does these little puzzles called Sudoku. Have you seen these? It's like numbers in the grid, and some of them are really difficult. Well, he timed himself on these Sudoku, and I remember he came in like a month into the program, and he was kind of upset at me because the time that he took to do the Sudoku was down. It took him longer. And sometimes I'll hear this of people who are big exercising folks. They'll say, my time's down, I'm upset. Why? I just said, give it time. It's just, you're just a month into it. And in this movie, Serial Killers, they took 6 months to fully keto adapt for exercising. It's probably the same for the brain, And so sure enough, 6 months into it, he's doing these little puzzles faster than ever. So his mental function, and this is a very sensitive measure of how the brain is working. You're timing these very difficult puzzles. The mental clarity is probably a major reason why people continue to do this, even though they got into it for a different purpose.
While we're on the brain, I thought that was the last one, but I thought of some more. Can you just comment, while we're still on the topic of the brain, on Alzheimer's?
Yeah, so Alzheimer's, also known as type 3 diabetes, is a problem of getting energy into the brain and like energy into cells. And so Alzheimer's really never was a big deal until carbohydrates started being a big part of the Western diet. And kind of in a typical, people try it and they see improvement. Dr. Mary Newport started using coconut oil and other things to raise ketone levels and saw benefit in her husband. And she went on the circuit talking about coconut oil for brain function and Alzheimer's. Sadly, he didn't have continued improvement, but the signal of ketones improving brain function is a strong one, and it may even prevent, I think more of it as a prevention for Alzheimer's, because once you have the disease, it's what we understand now, that it's been around a long time when you start having mental symptoms, the memory loss, but you might have temporary improvement. And so a lot of people try adding coconut oil or changing to a keto diet to see if it will help. But this is, again, not solid in the medical literature, but the signal is pretty strong that Alzheimer's may get better, even cancers in that sort of area of a lot of research going on. There's a lot of hope, but I can't say that it's going to definitively help yet. But if you were looking for something to do in addition to the current treatments that your doctor is giving, you might consider a keto diet for those conditions.
Eric, thank you so much for helping us understand a little bit more about the other benefits that a keto diet would help. I know there's a lot of people that would be interested in a lot of these other conditions other than the main ones that we mentioned in the beginning. So thank you so much.
I just have to say we keep learning. I mean, it's an exciting time for learning about what you can do by just changing the food. It's amazing.
Well, thank you so much. And guys, that's all for today. If you would like to grab that top 10 fat loss tips, Dr. Westman's top 10 fat loss tips, the link will be in the description. If you'd like to learn more about our academy and our upcoming new courses that we've got, you can find us at adaptyourlifeacademy.com. Eric, thank you so much on behalf of all of us here. We appreciate everything that you do. And until next time, another episode of Conversations with Dr. Westman next week. We will see you next week.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.